So let's start with the next about diabetic ketoacidosis. Okay. So today we will do the what are the causes and trigger of the diabetic ketoacidosis. क्या क्या कारण किस वजह से डायबिटिक कीटोएसिडोसिस व्हाट इज द मेन रीजन फॉर दैट। ठीक है। सो ये सबसे ज्यादा होता है टाइप 1 डायबिटीज मेलाइटस। ओके, द पर्सन who is suffering from the type 1 diabetes, it is most commonly seen in the type 1 diabetes. It is also seen in some occasionally in the type 2 diabetes, especially during the stress and the infection. Remember, infection is the most common cause for the DKA. The main trigger of the DKA is infection. So it can be any type of the infection such as UTI, gastroenteritis, okay? And it increases the stress hormones in the body like cortisol and the catecholamines, okay? And this cortisol and the catecholamines, they are the antagonistic to the insulin. So say depresses the action, insulin actions, and also decreases the insulin, which promotes the lipolysis, and then there will be formation of the ketone bodies. Okay. So in the last video, we have already studied what we have studied. हमने क्या पढ़ा था? हमने पढ़ा था कि जब इंसुलिन कम होता है तो लिपोलाइसिस बढ़ जाता है। ओके, तो फैट डिस्ट्रक्शन इंक्रीजेस। ओके, द ब्रेकडाउन ऑफ द फैट इंक्रीजेस, जिसको हम लिपोलाइसिस बोलते हैं, एंड देन देयर फॉर्मेशन ऑफ द कीटोन बॉडीज। Remember, even a mild fever can push a diabetic patient into a DKA if not monitored. Okay, so this is very important too. So second is, now suppose a person is taking insulin for a prolonged period of the time, and if he skipped the insulin accidentally or intentionally, okay. So if there is an obviously there is an decrease of the insulin, so there will be increase in the glucose level in the body, that is hyperglycemia, due to the that is glucose, no, it's not entering into the cells. And the second will be there is a more breakdown of the fats. This is called lipolysis, and there is a formation of the free fatty acid and the ketone bodies. Okay, seen in most commonly in the adolescent and newly diagnosed diabetes. नेक्स्ट क्या है? द पर्सन, ये वन थिंग आप याद रखना कि जब भी टाइप 1 के डायबिटीज के पेशेंट अचानक से ना सडन आते हैं, मैक्सिमम दे आर उस समय आते हैं व्हेन दे आर ऑलरेडी सफरिंग फ्रॉम द कॉम्प्लिकेशंस और द सफरिंग फ्रॉम द डायबिटिक कीटोएसिडोसिस, सडनली डायग्नोस्ड लाइक टाइप 1 डायबिटीज, न्यूली ऑनसेट. The person is, or the children or the adult, he is suffering from this diabetes for a prolonged period of the time, but it was undiagnosed, and when he is coming, then it already in the symptoms it go to the diabetic ketoacidosis. So these are the often that you see with the patient had come to the polyuria, polydipsia, weight loss, vomiting, and the fatigue. Okay. Next, okay, the stress stage. Already, whenever there is a stress, it can be shock, it can be injury, it can be burn. Okay, and this type of the stress hormones, they worsen the insulin resistance. Okay, so some of the stress states. Now, there are some drugs and the medications which basically increases the glucose level in the body. Okay, for example, the steroids. SGL2 inhibitors, they can cause euglycemic DKA. What is euglycemic DKA? That even in the blood, the glucose level is normal, but the patient has gone into the diabetic ketoacidosis. ब्लड में ग्लूकोज लेवल के नॉर्मल होने के बावजूद भी अगर आप देखते हो कि पेशेंट डायबिटिक कीटोएसिडोसिस के सिम्टम्स बताता है, then it can be, then this is your euglycemic DKA. Okay, now these are some of the drugs. Now see the pathophysiology of why the SG, in which way SGL2 inhibitors causes increase in the blood glucose level in the body. Okay, so the full form of your SGL2 stand for the sodium glucose co-transporter. Okay, and they are situated in where? They are situated in the proximal converted tubule. So this is one of the MCQ question. where the sodium glucose co-transparent, it is a protein found in where? It is found in the your proximal convoluted tubule. Okay, so it is found in the proximal convoluted tubules. And what is the role of the sodium glucose co-transporter? They help in the absorption of the glucose. Okay, so as a result, you will not find the glucose in the urine because the kidney gets absorbed and it returns into the body. So they plays a role in the glucose reabsorption. So when drugs like so when a drug like empagliflozin, so these are the oral antibiotic drugs, they what they do, they inhibit this mechanism. Okay, they inhibit the glucose absorption. Okay, they inhibit the glucose reabsorption in the kidneys, and what happened? The high amount of the glucose it excreted from the urine. As a result, you will find the symptoms of the glycosuria. Okay, so in DKA, that is, you will find the symptoms of the glycosuria, and in this way, it reduces the blood glucose level in the body. Okay, so in this way, it reduces the blood glucose level. Okay, now whenever there is a high amount of the sugar excreted from the urine, then there will be an increased chance of what? Some type other infection. For example, repeated UTI infection. Okay, so there may be itching in the vagina, itching in the vulva, and the patient may complain of the severe urinary tract infections and also the genital infection. See, and they also result in the euglycemic diabetic ketoacidosis. Why euglycemic diabetic ketoacidosis? As a glucose, now you will find the glucose in the urine, okay, the glycosuria. And we know that when the glucose and the it's going, it also take the water and the electrolyte, the sodium, potassium, so magnesium, phosphate. So there is an electrolyte imbalances, okay, and that resulting into the diabetic ketoacidosis. Even in the test report, you will see the blood sugar level is normal, but the patient is suffering from the diabetic ketoacidosis. So it is mainly due to the this type of the drug, SGL2 inhibitors. Okay. Yes. So now start with some MCQ. Okay. So euglycemic DKA is most commonly associated with A. Metformin, B. DPP4 inhibitors, C. SGL2 inhibitors, D. Sulfonylureas drugs. So I think everybody can comment in the chat box. So this is your SGL2 inhibitors. Okay, so very easy. SGL2 inhibitors. Now, which breathing pattern is characteristics of the DKA? Is it Biot's breathing, chain strokes breathing, Kussmaul breathing, and apneustic breathing? It is option C, Kussmaul breathing, deep breathing to compensate the effect of diabetic ketoacidosis. Which is the most common precipitating factor for the DKA? Yes, the most common factor is the infections because infections triggers the stress hormone which depresses the action of the insulin. Okay, so these are some of the MCQs. So thank you everyone. In the next part, we will do some other topic regarding the diabetes.